I'm Erin Shute, and my topic is birth control. Birth control can help people in a number of different ways, whether it's to prevent pregnancy, help alleviate the symptoms of a health problem, or just to regulate an uncomfortable or painful period. Many different forms of birth control help people from all walks of life. Unfortunately, not everyone that needs it can afford the prescription or even the doctor's visit. Today, the necessity for easily accessible and affordable birth control will be discussed. The need for birth control due to medical conditions will be explained. Then, the effect of birth control availability on teenage pregnancy will be shown. Finally, the negative effects of teenage pregnancy will be clearly illustrated. Polycystic ovarian syndrome, more commonly known as PCOS, is a medical problem that affects the daily life of women who have this diagnosis. PCOS can cause a multitude of problems, such as an overgrowth of hair, especially on the face, which can be embarrassing in a woman's day-to-day lifestyle. It can also cause painful periods. It's not uncommon for some of these women to miss a day at work or school due to pain from that time of the month. PCOS can even contribute to infertility, which can be the greatest nightmare of many women, myself included. These are just a few ways that PCOS can negatively impact a woman's life. According to the PCOS Awareness Association, birth control pills are often the first and least risky option of treatment to help alleviate some of the symptoms for the individuals who live with this syndrome. There are several complex statistics relating to teenage pregnancy and childbirth. According to the article, Teen Pregnancy in the United States, by the Center for Disease Control, or CDC, in 2014, 250,000 babies were born to women between the ages of 15 and 19. In the same year, 1 in 6 of those births were to females that already had 1 or more children. From these numbers, teenage pregnancy appears to be high, but in reality, it is declining. The birth rate of women in the age group of 15 to 19 years old is 24.2 babies per 1,000 births in the United States. This is a historic low for our country. There's a reason these birth rates are falling. Many experts agree that this is happening because contraception is more common and available than in the past. The rates of teenage pregnancy are highest in states that teach abstinence-only education. Young women are often told information that is misleading. Not only are they given misleading information, but often they're not given enough information to safely make a decision about sexual activity. When abstinence is the only technique taught, teenagers do not learn how to utilize proper methods of contraception, such as an oral birth control pill, an IUD, or more. Although there's undoubtedly a negative impact on the family involved with teenage pregnancy, there's also an impact on the general population. The CDC stated that in 2010, teenage pregnancy and childbirth costed taxpayers $9.4 billion. This money is sucked out of the economy due to an increased level of government money going towards teenage parents and their children through publicly funded health care. Low-income women have the highest risk of unintended pregnancy because they don't have the same access to contraception that other women do. This concept is crazy to me because if you can't afford birth control, how could you afford a baby? The Guttmacher Institute conducted a study on how family planning reduces the amount of spending on things such as Medicaid. In fact, for every dollar the government spends on family planning, taxpayers save $7 that would have otherwise been spent on funding a family. They also found that in 2010, 2.2 million unplanned pregnancies were prevented thanks to birth control. Overall, $13.6 billion were saved by focusing on prevention rather than providing a remedy to the outcome. There's several different ways the birth control could be made more easily accessible. The biggest ways for insurance, such as Medicaid, to take care of the cost of birth control where it's needed. Another way would be to implement clinics such as Planned Parenthood in more locations so anyone that needs to could easily visit. Finally, as a society, we need to teach the upcoming generations where they can find these tools to safely have sex. People use birth control for an array of different reasons, all important. Some women use hormonal birth control to control the effects of medical conditions. Other women simply use birth control for family planning. Either way, making this medical necessity accessible for everyone that needs it should be a requirement. In the end, taxpayer money is better spent on preventing unplanned pregnancy rather than dealing with it. Birth control is not only good for the individual, but for the country as a whole.